So moving on, our next speaker, so the story behind this is that at ECR this year, there was, I suppose, unsurprisingly, a lot about sustainability in radiology, climate change. And I happened to be walking past the Philips stand, and they had this kind of massive screen display of a video of, you know, sustainable water, what Philips were doing. And they basically had a stand where they asked you a whole lot of questions and wanted to know what you were doing in sustainability. And I'd been charged recently with putting together a strategic paper, what radiology could be doing. And there's actually increasing amounts in the literature now. But I thought it's, and interestingly, James Tanner, I don't know if James is here, where's James here? James is online, and also Matthew Wallace, both came back from ECR and said, we need to be doing more about sustainability. We need to be properly recycling. We need to stop opening these packs and not using them. And we need to be much more judicious with our use of single agent products in the department. And I thought it would be really useful. We should be turning our attention to this. A hybrid meeting, for example, you know, lots of people on, or what was it, 50 online at the moment. It means they haven't had to travel here. They can, I suppose, be doing a bit of reporting and hopefully listening to what's going on. But Lawrence Drost is leading the sustainability project for Philips, together with his partner in crime at Philips, Olesya Struk, and I think they're both going to be speaking to us now. Lawrence, are you online? Are you with us? Oh.
Yes, we are.
Hi, Lawrence. Thank you so much for agreeing to speak to us today. Where are you at the moment?
We are in the Amsterdam Tower, Philips headquarters.
Oh, excellent, excellent. Okay, without further ado, please share with us what industry is doing and what Philips in particular is doing in terms of making radiology more sustainable. Thank you, Lawrence.
Absolutely. And I can give it to my colleague Olesya Struk to please begin.
Yes, thank you very much, Lawrence, and thank you very much, Professor Gilbert, for invitation to this meeting, and good afternoon, everyone. I hope we are well audible. Indeed, we are joining from the Amsterdam Tower, and very happy to have a privilege to speak to you today about sustainability. Indeed, in our presentation, we would like to share what sustainability topic in radiology is and the angle that we are seeing from Philips, but also a call for collaboration, because sustainability topic is a far-reaching one. And in fact, so in the healthcare, carbon footprint emissions are amongst the highest among all the industries. It's about 4 to 5 or sometimes to 10% of national emissions. While when we look also on the radiology as part of this, about 2/3 of the world's population lack access to imaging technologies. And again, it's a challenging, of course, to follow up on the presentation by Dr. Barter. At the same time, in the presentation, Dr. showed a wonderful journey also about the technology and this beginning of the technology. But this is where also it's good to look into the future, because the technology is there to develop, and also it's up to us what are the next possibilities that will make our healthcare also more sustainable and also reaching more patients, and in a way that makes us also better and more comfortable for both patients and for staff. So it's not about Philips, and we just would like to share what Philips has done about it and some of our thinking, and because we cannot do it alone. And it requires broad collaboration across the industry, and therefore we appreciate your feedback and thoughts after this presentation. We'll leave some time for Q&A, if that works also for the format of this meeting. Very briefly, just a recap about Philips and what we do about it. So we pursue the purpose where we put the patient in the center of what we do, and we aim to improve lives by the technology that we develop and the innovation with partners. and also being mindful to be a good place to work for people that decide to join us, and to deliver great value to our customer shareholders while acting responsibly towards our society and the environment. And for example, already 2 years ago, we became carbon neutral in our operation. One of those topics that seems to be quite complex and challenging, and at the same time, although Philips footprint operations is not as big as in healthcare, at the same time, just wanted to share that we believe it is possible, and when we collaborate and partner on decarbonizing and becoming carbon neutral. If we dissect the subject into specific parts and modules, and we call for collaboration on this, then we see a great next steps that will unfold. Specific elements that we put as targets for Philips as a health tech company, and therefore the domain expertise that we are growing. First of all is health and well-being for all. And one of my personal passions is access to healthcare to improve lives of people, but also to improve lives of people in the underserved communities. The second one, and Dr. Drost will also be in a position to speak much more about it, is circularity and moving the economy towards the circular business models and circular flow. And we committed to continue making sure that we trade in of all professional medical equipment, we take it back in the end of their life, and we offer the replacement while we are taking care of the technology responsibly. The third pillar is a climate action commitment, and we committed to 1.5 degree global warming scenario and to science-based targets to deliver on this. And for this, we need partnership, as mentioned at the bottom of this slide. And the part was what we do as Philips in the core of it is our innovations, also based in the Netherlands, but also in a few places around the world, is that we commit to design all our products with the eco-design requirements. Now going back to the industry, broad in healthcare, we believe that the time to act is now. As I mentioned, the healthcare system accounts for a significant part of the global CO2 emissions. Globally, it's 4.4. In the UK, it's also a little bit bigger, which is more than aviation or the shipping industry. And when you look at the circle here on the side of the slide, then one part of it is scope 1, scope 2, and scope 3. Scope 1 is the own operations of the hospitals and care providers. Scope 2 is purchase energy, and we're quite happy that we gradually altogether moving more towards renewable energy. And the scope 3 is actually purchase goods and services. 70% of the carbon footprint is there. So hence the call for collaboration, and that's the part that we can do together across the industry. In radiology, and I just would like to mention a couple of key challenges, and of course, you would comment about this and speak much more about this. Just a couple of the facts that, for example, 68% of the unanticipated events happening during the examination. And here you'll see the flow that has the complete flow from the scheduling, image acquisition, image data interpretation, reporting, shared decision-making, and radiology outcomes. And along this flow, there are challenges that have striking numbers behind them. For example, on the acquisition technologies, we see that in the United States, 44% suffer moderate or severe level of job stress. And in radiologists, about 45% have symptoms of burnout. Right? And then another striking number in orange, that's 97% of radiology departments are unable to meet the reporting requirements. While actually the growth of healthcare data, the purple data points below, 36% is expected growth rate of the healthcare data. And this is where also speaking about the technology and the future of it and the possibilities that data unfolds, that we need to go through the challenges of this. But this is also how the next direction will set us up for sustainable approach. Now on this, speaking the challenges and the call to act now on sustainability, I would like to hand over to Dr. Drost to walk us about this further.
Thanks, Olesya, and thank you, Dr. Gilbert and Cambridge for the opportunity. So one of our goals at Philips is to help customers reduce their carbon footprint. And we do this by helping you to reduce your physical resources and your energy use, and then also your supply chain impact. And to do this correctly, it requires also partnership with the clinic. So you see the top bar there. The clinics need to assess what is their energy, and for instance, what is their waste. And then on the bottom bar, you see it requires staff engagement. That it really requires getting the staff involved, figuring out what improvement ideas that there are, and continuously feeding back. Next slide. And how do we do solutions, both for that and some of the issues that Olesya mentioned to help with your workflow efficiency. So one of the ways that we help is first-time diagnosis. So the example here is our new spectral CT machine, and that gives potentially 25% reduction in repeat scans, 50% reduction in follow-up scans, due to the ability to have all the spectral information in every scan right there. Next slide, please. Another way we can increase productivity and thereby decrease energy use. So an example there is we have our MR SmartSpeed technology, and that now gives you higher image quality and faster scans, up to 53% per scan, 52% on average. And of course, we're also looking just at the general hardware. How can we squeeze out some additional energy savings? And some of you may be familiar with the COSIR energy methodology, that it's actually not just scanning energy use that's important. The standby use is actually one of your highest impacts. And so there we have power save mode, where it switches quickly to power save mode. And then we have lower energy use during that. Next slide, please. And finally, we want to strongly recommend that you consider refurbished systems in your portfolio. Of course, you're going to want some flagship systems for your cutting edge work, but then you can greatly lower your carbon footprint from the supply chain standpoint by including some of these refurbished systems, and they're guaranteed with the same uptime guarantees as the new systems, same quality, and greatly reduced carbon footprint. Next slide. And just to give you an overview how we approach our eco-design, we have different buckets. We have energy, packaging, substances, and circularity. And they're analogs as well to your clinical practices. So energy, of course, we're designing our products to use less energy. And in your case as well, there's only so much that we can do, and then you need to look at turning off equipment at the end of the day, and also decarbonizing the grid, stuff like that. Packaging, we're looking to minimize plastics and reduce our overall packaging waste. You know, that's a concern for your clinics as well. Substances, yeah, the main one that we get from clinics is in our tender questions is restricted substances, but then we know you have other issues, particularly indicator fluid recycling. That was brought up in some of the plenary sessions at ECR. And then circularity, that's a very important one that we're really looking at the design of our products and how to make them more circular so that they can last longer and be reused. And then on the right, you see a modification of the famous butterfly diagram that reflects more what we're doing with equipment. So the lower loops on the bottom have higher value. So at the bottom, you really want to use less material if possible. And then you want to extend the lifetime, so service. And then above that, you have refurbishment, parts recovery. And then finally, we're looking to make our products more recyclable in the end. Now I'd like to hand it back to Olesya to discuss the important work that she's leading on access to care.
Thank you, Lawrence. On the access to care, as I mentioned, the people around the world experience unfair and avoidable barriers to health. At the same time, these are also often people that are next door. In any country, and especially during the COVID, also and post-COVID challenges, often happens that people lack access to diagnostics, to imaging technology, and to healthcare that they need at the moment. When we look at the at the area and countries that have even significant barriers, significant gaps in this, that we have also high rate of the female deaths from preventable causes during pregnancy. We have huge distances also that men and women have to travel to receive the care they need. And when we look also at the diagnostics of this is the basis, and of course the possibilities of the technology to provide this diagnostics remotely or to provide it in a way that could be done from different locations, then we can see the vision that could make it happen in the future. At the same time, keeping in mind sustainability, environmental responsibility of this. And thinking also about the remote areas, and for example, sub-Saharan Africa, some of the regions that suffer a lot. But this is also where a lot of solar power and the energy can be captured and used even to power the devices for this. Ideas about expanded equitable access to healthcare, something that we came across on our practice, is a driving the digital transformation of healthcare through innovation, including virtual collaboration, including the workflow improvement, task shifting when we are talking also about the rural or remote areas. New business models and financing solutions to make the solutions more accessible and affordable in an appropriate way. And also building strong partnership, as we believe also for environmental sustainability as well, to take this even no less high barrier of access to remove that consistently and in a steady way. Then in closing, so we just share some ideas, perspectives, examples how we do it in Philips, but again, it is about a partnership. So we have a call for collaboration across the industry on sustainability. Here's an example that we are proud of, that we partner with the Champalimau Foundation, a leading cancer center in Portugal, where we both committed to collaborate and partner and reduce the carbon footprint with the help of technology, workflow improvements, and also a few other elements that we have in our realm. In fact, this collaboration, we saw this possible by bringing our key capabilities together. And in ECR, as Professor Gilbert nicely introduced the topic, so we did the experiment. We launched the sustainability zone, and in a collaboration with the ESR and with the Healthcare Without Harm, and we are very happy about the engagement. We opened the call for sustainability in radiology community. So we ask people to sign up for the community. Right now we have about more than 160 members in Europe. And we would like also to extend this invitation to you. So there's a link and password to access it. For now, what we offer just to connect you with the contacts on the sustainable radiology. And this will be the power of knowledge sharing, collaboration, creating the movement to unpack this. Rather, in a way, it's a young area. At the same time, again, referring to the previous presentation, the radiology has done so many strides in the decades. So we would be quite happy to continue to participate in this movement. With that, thank you very much. So this is the end of our presentation. Thank you for invitation. If there is a room or intent for questions, then we are happy to take those.